I'm Dr. Hamid, and this is Dr. Praveen Jacob. He is the consultant at Nisarga Mane Sirsi. He is the adjunct professor at K.S. Hegde Medical Academy, Mangalore. He is the CEO of Alpha Naturals. He is also the scientific advisor at Atmantan Wellness Center, Pune. Our world is filled with dualities. One such duality is fact and myth or misconception.
Absolutely right.
But the thing about false beliefs or misconceptions is that it eventually gets proven wrong. So one such misconception like that is that the earth was flat. Long ago, people believed that the earth was flat, that it was a flat surface, an endless flat surface.
Yes.
And now it is proven wrong. We all know that the earth is round. So one such false belief in the medical field that we had until recently, fried food, spicy foods, stress and anxiety are the causes of ulcers, gastritis, hyperacidity and disorders related like this. But now, as we always know, truth prevails. It is a proven fact that a small tiny bacteria called as H.Pylori is the root cause of these issues.
Yes.
So it is not spicy foods or anxiety, but it is a bacteria known as H.Pylori, Helicobacter pylori.
Yes. Yeah. There's a saying, wrong knowledge is more dangerous than ignorance.
Wrong knowledge
is more dangerous than
ignorance,
which is 100% justified in this matter, and particularly regarding H. pylori. I always insist in my talks that most of the disorder or ailment our modern societies afflicted today are result of wrong knowledge, and particularly wrong knowledge regarding food habits. There had been many myths. Fat is bad, the cholesterol is bad. Cholesterol can contribute to coronary vascular disorders. Yellow portion of egg is dangerous, rich in cholesterol. There are numerous misconceptions, wrong notions regarding type of food habits.
The most misconceptions that is problematic to health in this era, in this time, is the misconceptions and myths about false knowledge about food.
Food habits and diseases.
And how a disease comes from.
And disease comes. So because cholesterol causes heart disease. Ultimately, eventually, the wrong food habits step us to disorders and disease. And we do know that excess calorie causes diabetes. We had been accusing our gene for diabetes earlier. Definitely. And it is no longer cholesterol contribute to heart disease. It is the inflammations. So many myths had been busted today. And likewise, I would like to bust a myth, and I would like to debunk a myth regarding hyperacidity, gastritis, gastric reflux disorders, bloating, indigestion. The myth is nothing but the acidity, indigestion and stomach disorders are related to spicy food, stress and fried foods. Then who is the real culprit here? I had been briefing you. Diabetes is not related to pancreas or insulin. Diabetes is related to obesity. The cardiovascular disorder is related to inflammation. It is no longer related to bad cholesterol, isn't it? And similarly, acidity is not related to spicy food or stress. It is mediated by a tiny creature, an invisible microorganism, a notorious bacteria called as H. pylori, Helicobacter pylorus. For this particular discovery, Nobel Prize of 2003 had been awarded. A scientist proven that a bug causes acidity and stomach inflammation, gastritis, stomach cancer and gastric inflammation.
It's not just about ulcers and indigestion. It is also the cause of cancer.
Cancer as well. The stomach cancer, for instance, which is the fourth leading cause of cancer death worldwide. Stomach cancer.
Stomach cancer.
Stomach cancer is the first leading cause of cancer death worldwide, which is very fatal type of cancer. So the survival possibility is very rare in stomach cancer, which is mediated by H. pylori bacteria. 99% of adenocarcinoma of stomach, the stomach cancer, are responsible by this bacteria.
This H. pylori bacteria is more dangerous than HIV or other bacteria that cause a lot of, that people are very scared of. That if we hear about HIV, it sends a chill up your spine. It's very scary for people. But are you actually telling us that this bacteria is even more dangerous than HIV?
Definitely. Might be in India, HIV might be killing 1 lakh individuals every year, but H. pylori might be killing close to 2 lakh every year. More than HIV. Double more than HIV.
So, understand this. This is something that people overlook because they think it is just acidity or it is just burping. It is just a small case of stomach ache. Maybe we can overlook it. For some people it is very irritating, very annoying, but for most of the people, they just overlook it and they take some kind of painkillers or acidity tablets and they just go over it. But some people, even though they take all this, it keeps on prevailing, it keeps on coming back. So what could be the reason for that?
The answer is H. pylori. It prevails in the stomach of 60% Indian population. But only 5% develop symptoms. Very significant to note down this point. As high as 60% of Indian population harbor this notorious bacteria in our stomach, but for most of the people, they're asymptomatic.
For only 5% of the people who are infected by this bacteria are symptomatic. So is it the people only affected by this bacteria who are having gastric problems, or is there any other reasons for it?
Multiple factors can contribute in the progression of gastritis, but the major driving factor of gastritis, acidity, and particularly chronic gastritis is mediated by H. pylori bacteria. But for few individuals experience acute gastritis. Like when you take a hotel food one day, next day they get some trouble in the stomach. It's called as acute gastritis. It is likely to subside in 1 week. If the acidity, gastritis and stomach inflammation does not subside in a period of 1 week, it persists for longer period. Beyond that period, we can suspect H. pylori, role of H. pylori. And second driving factor is long-term abuse of non-steroidal anti-inflammatory drugs, which are nothing but painkillers. Painkillers block a inflammatory pathway in stomach and leads to excess production of a hormone called as prostaglandin that can ultimately manifest as gastritis. That, so this diet mediated and painkiller mediated could be 20%, H. pylori mediated could be 80%.
There is acute and chronic. So acute is something that comes suddenly and it disappears faster. Chronic is something that is has a sturdy foundation. It is very firm. It knows its roots. It knows how to stay. It knows how to make problems, and it persists for a long time. And that is mostly caused due to H. pylori. And this gastritis that is caused by H. pylori eventually leads to bigger problems, bigger and harder problems to tackle, which are GERD or IBS or even cancers. Even cancers are part of this problem that are chronic. For all of these stomach conditions, we are getting the same pills. We are getting, even if it is herbal medications or diet remedies, they all try to aim to make the
neutralize stomach pH.
Stomach pH, exactly. They are trying to reduce the
acidity of stomach.
Is this a good way to do this?
Yeah, see, we often witness gastric patients preferring to consume alkaline foods like ashgard juice, apple juice, cold milk, antacids, cold bath over stomach, different types of modalities they will see. But you see, none of them get permanent relief. That is important. even alkaline juice, it relieve your symptom for 2 or 3 hours. After 3 hours, it bounce back. So the permanent solution, we need to eradicate this notorious bug. That's a permanent solution, first and foremost solution, for which I have successfully developed a protocol called as triple therapy.
But before that, I want to ask about another very famous remedy that people use nowadays. It is nothing but apple cider vinegar.
Yeah.
So I've seen a lot of people having this for their acidity problems.
Okay.
And some people, they say that they have cure for it, that they feel better, but some don't.
It's a contradictory phenomena. Vinegar is acid with a low pH. How to counter hyperacidity by an acid solution?
Acid solution, exactly.
That's an incredible question as well. H.Pylori, as I pointed out earlier, is a notorious bug. It can incite to contradictory phenomena inside our stomach called as hyperacidity and hypoacidity.
Hyperacidity
and hypoacidity. 60% of H.Pylori infected individuals develop hyperacidity, whereas 40% tends to develop a condition called as hypoacidity.
So it is nothing but hyper means more acid is produced. Hyper means more acid is produced in the stomach. So 60% if H. pylori infects you, 60% of you will have more acid production, and 40% of you will have less production of acid in the stomach.
Yeah, absolutely right.
Okay. And what is the significance of this? Or what is there?
It's very significant. That's what the individual with the hypoacidity get benefit with apple cider vinegar.
Okay, so if you have less acid in your body, if the people infected and if they are showing symptoms of hypoacidity, the apple cider vinegar is going to be beneficial.
Boost your acid production and give rapid relief, sudden relief from indigestion and pain.
Okay. Okay.
And unfortunately, the symptom of hypoacidity and hyperacidity can be precisely same. Very difficult to distinguish whether the indigestion, bloating, stomach discomfort is mediated by hyperacidity or hypoacidity.
So it is very difficult. So as doctor says, it is very difficult to know the difference by your common symptoms. Usually when we go to a doctor, they just ask you a set of questions, and it is very hard to know by that if you have more acid production or less acid production. So hence I think it leads to the confusion in the mode of treatment.
Yeah.
Is there a difference in the mode of treatment?
Absolutely right. Many patients. I had a patient from Bangalore, around 70-year-old man now. When he was into first standard, as young as 5-year-old, indigestion developed. And his life was literally hell thereafter. Literally hell.
At 5 years old?
5-year-old, he developed indigestion. Indigestion, bloating, and giddiness.
All the symptoms.
All the symptoms of gastritis had been developed. And he was on antacids from long time. Do you believe? Almost 65 years he was on liquid diet. He couldn't digest any hard foods. The major food of this gentleman was liquefied solid foods.
Okay, so he grinds the solid food
solid
that he usually eat and takes it as a liquid form.
And he got admitted in our hospital, Nisarga Mane, Sirsi. On second day, I did apple cider vinegar testing to him. Okay. I asked this gentleman to consume 2 teaspoons of apple cider vinegar mixed in 1 glass of water, just 10 minutes before a protein-rich meal.
A protein-rich meal?
Protein-rich meal, like paneer.
Okay.
I given 2 spoons of apple cider vinegar mixed in 1 glass water, asked him to drink
just before, 10 minutes
just
before
10 minutes before food,
having the protein.
So he told, first time I'm able to digest paneer.
Over 60 years.
60, 65 years.
This person has suffered so much, even though he's taking medications.
Medication, yeah.
He was not able to eat properly. He was not able to enjoy his food
properly. His foods, yes.
He was always having liquid diets.
Yeah.
Even solid foods he was having as grinding it down and eating it as liquid form.
Yeah.
And he came to you, and after this test, after you giving him apple cider vinegar, he felt better.
felt better, much better.
Much better.
So I diagnosed his case as hypoacidity. That's why he got relief when I asked him to ingest low pH solution, apple cider vinegar.
So it is very important to know the difference between hyper and hypo.
Hyper and hypo.
Because he was taking medicines, but it was for hyper.
Medicine. He stopped all medications. He was back to normal diet in a span of 1 week. Surprisingly, he gained over 15 kg weight in the span of 3 months.
In 3 months, 15
3
kg.
months, 15 kg weight.
So for those of you who don't know, this condition is very tormenting. You can't have food properly. You literally become scared to eat.
Yeah.
If you see something that causes this, you get scared. You can't have food properly. It causes panic attacks. And this gentleman was underweight. And so know the importance of proper diagnosis and proper intervention. The proper medicine can only solve a problem.
Yes.
So always understand hyper and hypo can be mistaken.
Yeah. If the apple cider vinegar test is
A very easy
test to do.
Just
if someone finds comfortable with apple cider vinegar, that implies that
they have low acid.
Low acid.
Okay.
If someone it get irritation, apple cider vinegar, they feel that my stomach is burning, I feel too vomiting, I get nausea. So that indicates that that particular individual is producing too much acid. So it's a simple test. Apple cider vinegar, 2 teaspoons, 10 minutes before food. If the person is comfort with apple cider vinegar, hypoacidity. If he is annoyed with apple cider vinegar, hyperacidity.
Tell us more about the triple therapy, the natural triple therapy.
Triple therapy, yeah. Allowed to speak about triple therapy because I had been formulating various protocol for different type of digestive health disorders and metabolic syndrome since 10 years. Unfortunately, my gastric protocol emerged as number 1.
So you are having a very successful treatment for gastric issues.
The formulation which I have found are highly beneficial to eradicate H.Pylori and consequently to control hyper and hypoacidity. And I call it as triple therapy. Why I am calling it as a triple therapy? It's very important to note down here. Triple therapy is the conventional treatment for H.Pylori in modern medicines.
In modern medicine,
modern
triple
medicines.
Therapy is the normal.
Yeah, normal triple therapy, which consists of 2 antibiotics and 1 antacid in a single pill.
In a single pill?
In a single pill. Okay. 2 antibiotic and 1 antacid is combined together, and a course of this protocol is administered to patient. Globally, this protocol is followed. The gastroenterologist in Africa, Antarctica or United States or in Asia, the same protocol is followed for gastritis.
Yes, so in modern medicine, all over the world, globally, if you go to any doctors with the case of gastritis, the common treatment that they give, irrespective of hyper or hypo, the treatment that they give is triple therapy. You named your treatment, the one that you invented or you found out, the same name as the normal protocol.
Yeah, natural triple therapy.
Natural triple with the word natural.
Natural triple therapy.
Natural triple therapy.
And I can proudly say that most successful protocol ever I have invented is natural triple therapy for H.Pylori bacteria.
Okay, sir. So can you tell us what ingredients that you have in your natural triple therapy?
So my natural triple therapy consists of diet, probiotics and herbal formulas.
Please tell us more about the diet and probiotics.
Yeah, diet I follow a nickel-free diet.
Nickel-free diet.
Usually half of the plate must be fruits. And 25% steamed vegetable. Rest of the food can be conventional, normal breakfast or normal lunch, like small quantity of rice.
Usually we have more dosa or idli or rice.
Yeah.
So instead of that, make it just quarter of your plate.
Quarter of plate, yeah.
And half of the plate should be fruits, and another quarter should be
steamed vegetable.
Steamed vegetables.
Yeah.
I also heard that yogurt is also good.
Yogurt also very good because it's a rich source of live bacteria.
Live bacteria.
Which has potential to attack H. pylori.
H. pylori.
H. pylori, yes.
So this good bacteria is going to work for us just like our white blood cells, like our policemen. They are going to
attack.
And
they are going to counter H. pylori bacteria.
Exactly, sir.
And second is natural herbs. Natural herbs. There are wide range of herbs with antibacterial property. I have formulated a herbal remedy combining 12 powerful natural herbs, which all has been proven to minimize bacterial growth like H. pylori. For example, licorice, Adimadura, Jeshti Madhu, a herb from India. Numerous studies found that the H. pylori can be eradicated by some of the compounds from licorice. Black cumin, Nigella sativa, black cumin, amazing herb to reduce H. pylori overgrowth. And third one, ginger, cinnamon. Likewise, I have combined extracts of 13 powerful Indian herbs and combined and made a formula highly beneficial. Even chronic H. pylori patients got complete remission just in 1 month.
So is it like conventional antibiotics? Does it kill good and bad bacteria as well, or does it just target H. pylori?
The H. pylori is a pathogenic bacteria.
Yes,
so usually the advantage of herb is that you can target particular strains. Unlike conventional antibiotics.
It's not a broad spectrum.
Where in a broad spectrum, it damages good and bad. Good and bad. But you can choose bad bacteria in natural herbal formulations. And my formula is called as Gastrosol, Alpha Natural Gastrosol, formulated by combining 13 herbs, powerful herbs, extract of antibacterial powerful herbs. So that is a second component of triple therapy. And third is probiotics. So I have two types of probiotic. One is aloe vera based natural probiotic, and second my own formula, a supplement for, it's called as Florasol. One is aloe vera based probiotic, second is Florasol.
Can you tell us more about the aloe vera, because everyone might not be...
Yeah, it's not raw aloe vera. All you have to do is ferment it.
You have to ferment.
We have different methods to ferment for aloe vera probiotic. Aloe vera, around 5 to 7 days of fermentation yield a liquid which is rich in live bacteria, nothing but probiotics. Beneficial bacteria. Okay. And addition to that, the Florasol, which I have formulated, is particularly can target H. pylori, which is a blend of 15 strains of helpful bacteria, which can counter H. pylori. So the probiotic strains from the healthy bacteria from aloe vera probiotics, and the 15 strains from Florasol, which I have formulated, can collectively counter H. pylori.
So you are targeting the root cause.
H. pylori from multiple angles. Multiple angles I am attacking. So a small portion of the H. pylori can be killed by herbs. A portion can be killed by probiotic from aloe vera. One more portion can be killed by Florasol, which I have formulated. And addition to that, diet boost our immunity. So immune system also can attack a portion of H. pylori bacteria.
I wanted to explain one more aspect of the diet, which Sir needs to explain to us about, is the nickel-free diet that he told. So tell us when we reduce nickel, see, all food contains traces of minerals. So nickel is a mineral, and it can be, traces of it can be found in foods that we eat, like wheat or rice. And this, when we reduce this, tell us what nickel does for H. pylori.
H. pylori invariably require an enzyme called as urease to function properly. And the urease enzyme is get activated only by nickel. So if you stop nickel from your diet, H. pylori growth can be minimized.
So we are minimizing the growth and the infection on one end, and we are trying to attack it from another end. And we are sending more soldiers from another end. So we are actually giving it a very good chance for recovery. We are not leaving any paths open. We are catching it from all the sides.
Catching and countering from all angles. It's like Navy, Army and Air Force. a collective attack
on this
notorious bacteria. So it's like a triple therapy, Navy, Army,
and the
Air Force. Likewise, the probiotic, gastrosol, the natural herb, and diet, a triple therapy.
Superb, sir. That was a really amazing take on a very, very, very relevant issue.
Yes.
Because it is prevalent, more than 60 to 70% of the world population has it. So it is a very, very informative topic on what you spoke, sir. Thank you so much.
Thank you.
And I hope we can speak to you on another very informative and beneficial topic in another episode. Thank you for coming, sir.
Welcome.
Thank you, everyone.